Good afternoon, this is Dr. Doe. On alphabetically list of the problems or symptoms, still on A. Today we're going to talk about arrhythmia. Before we talk about arrhythmia, I'd like to just briefly talk about the heart, the function. Heart has left and right side, and there's the atrium and ventricle. So that's the structure. And the heart has automatically regulated pacemaker to start to maintain the heartbeat regularly to pump out blood. So the pacemaker is located on the right atrium, inside of the right atrium. So the heart function determines by two factors: either the contractibility, how strong the heartbeat contracts, and the rate of the heart contract in order to maintain normal perfusion to the organs. So these two, the rate and the contractibility, maintain the heart output in the regular right amount to meet the need of the body. For instance, the newborn, because the heart is not very well developed, how to compensate this? By increased heart rate. So the infant had heart rate about 100, could be 160, because the heart the force of contraction is not that strong. Then compensate, raise up the speed, the rate, so then the body perfusion will be maintained. So usually for us, the heart rate, normal heart rate is between 70 to 90. Either you too fast or too slow. It's not in the normal range. However, young athletes, they can have the heart rate lower than 70, about 60. So that's a different category. All right. So what is arrhythmia? Basically, either your heart rate is not in this normal range, too fast or too slow, or the regularity is lost. The arrhythmia means your heartbeat is not in regular base. Fast, slow, slow, fast is unpredictable. So these are the category of arrhythmia. What kind of arrhythmia can be managed at home? What kind of arrhythmia have to go to emergency, and what kind of arrhythmia you need to call your physician? Basically, let's talk about the symptoms. What kind of symptoms you might have? You feel heart palpitation, or you feel, if the heart beat really fast, you feel palpitation like something's jumping in the chest, thrilling fast. And if it's slow, if the heart rate is slow, you might feel dizzy. Some even worse has the more altered mental status. So that's the symptoms. Basically, you feel your heart is not feeling as regularly beat. You can feel different. So that's the symptoms. What kind of there's a tachycardia, which means your heart rate is faster than usual, and there's a bradycardia, which is your heart rate less than 60. Okay, for the tachycardia category, there's one category you can manage at home. It's called palpitation caused by the caffeine, for example, paroxysmal supraventricular tachycardia. So this is the category you can manage at home, because there's no organic heart disease and you occur in young people. There's trigger factors, for example, caffeine. If you drink coffee, you're not a coffee drinker, just occasionally drink coffee in an empty stomach, you might feel heart rate beat really fast. And what to do in this case? Stop the coffee right now, right away, and you can find something sugary like juice or candy to compensate. The mechanism is because the caffeine really stimulates the sympathetic nerve system, and if you add some, so that means the metabolism is faster. Then you need to supply the sugar or juice to your heart beat faster, metabolism is faster, you need to have the resource what to metabolize on. So you add some sugars, so then you'll feel better. There's another category for dehydration. For example, you did not drink well, you were under stress, and you from lying down to sit up, you feel your heart really beating fast, and you feel black or sparkles, almost fainted. So this is the case. You probably have this paroxysmal supraventricular tachycardia. So what do you do? Rest, sit down or lie down, or drink some fluid to feel better. And so these are the only category I can think you can, or you can, like I said, if these things happen in young people, you do not know or nobody tell you you have the heart disease, you can. However, if from what you have done does not make you feel better, then you need to call to see, to make the appointment. There's another arrhythmia called premature contraction, either ventricular or atrial. Pretty much you can manage at home, or you can, it will go away. It's the premature atrial contraction. What does that mean? You feel you're sitting there. First of all, the event occurs when you're resting. If it occurs when you're active or doing activity, then you need to see physician. But if you're sitting there, your heart beat, suddenly you feel an irregular beat. That, and not often, just occasionally occur in young people under stress, like I said. If that happened, you can massage on your neck, gently massage, it will go away. However, if it occurs very frequently, then you need to see your physician, discuss, and to do the EKG or imaging study to check in the chambers of your heart, make sure there's no organic disease. So basically, these are the three things, actually two, you can manage at home. Other than that, you need to call physician. Worth to mention is there's a disease called, you probably know that, AFib. Atrial fibrillation. It's very common in older patients, has a disease like hypertension, diabetes, or any other heart valve disease, something like this. For this kind of patient, I'm sure you were diagnosed and you were treated. What I'm talking about is follow the guideline, comply with the physician. Whatever the medication they give you, you need to follow to make sure the heart rate is stable and the rhythm is back to normal. At least maintain the regular rate. Okay, so this is the very common and sometimes could be very serious problem. There's another category, like I said, bradycardia, which means your heart rate is slow. It's lower than normal, lower than 60. There's different type, different severities. Okay, so for example, the first degree bradycardia, you are diagnosed by a physician, said you have first degree heart block. Okay, caused the bradycardia. No treatment at this moment, probably they said, or give you some medication or no medication, just observe you closely. For this patient, if you were told you have first degree heart block, you need to be really careful, monitor yourself. If there's anything happen, like you feel dizzy or your family notice you change mental status and you feel fainted, and this is the case, you need to call your physician. And I'm sure there's a second grade or third grade, those patients is in very severe situation. I'm sure your physician give you medication to take it and you just comply with it. Okay, so this is just briefly introduce the arrhythmia. Some of them not serious, like I said, you can manage at home, or some you need to call your physician. Like the emergency situation, like I said, arrhythmia caused altered mental status. You feel like a chest pain, associated with chest pain, and you feel like, oh, my heartbeat not regularly, I feel pain and I feel not enough oxygen. Then you need to call the emergency to check it out and to treat. Okay, so this is about arrhythmia. And if there's something missed, I will just catch up next time. And again, call your physician if you have any concerns or visit the emergency room. Thank you for watching. I'll see you next time.